Good morning, good afternoon, and thank you so much for being with us. If you can hear us and you're with us, we're excited. If you can't, bear with us just a second. We're excited to be able to get started here in just a moment. In the meantime, today we're talking about health aides and the health office really as a whole. And so I'll invite you now to just take a moment to think a little bit about what your health office looks like. How do you manage your health office? Who's in it? Is it a school nurse? Is it an admin person that's up front? Good morning and good afternoon, everyone. Again, we're so excited to be getting started here. This is our first webinar after break, and I don't know about you, but we certainly had a great break and a great time to rest up and be excited about the new year and, well, more excited about the summer coming around. So at any rate, we're very excited to be talking with you today, and our topic today is all about the health office. And so as we've done throughout the series, we're going to be talking through a number of different components of the health office. We'll talk specifically about who's in it and what they do. We'll share some different scenarios with you about some success stories, as well as maybe not so much. And of course, by the end of it, we'll be able to make sure that we answer all of your questions and also talk a little bit about specific things that have come up for you on your own campus. And as always, if there's a question or a concern that comes up that is hyper specific or just really is only to do with you, we may follow up with you afterwards as opposed to answering it for everybody. But then again, we may share it with everybody if that's okay with you, because occasionally those things that you may think are just only on your own campus actually happen everywhere. So with that, I'll go ahead and get started. Just a little bit of quick background about who we are and what we're doing on this webinar today. Joffe started in 2007 with the goal of being a CPR and first aid company and an event safety company, and doing both of those things really well. And as we started working with schools, and the more schools we got, the more schools asked questions, and the more we tried to challenge ourselves to do a little bit more and to give back and to support them on all of these things that went from, of course, our CPR and our event safety, but really went all the way up into disaster preparedness and business continuity and crisis communications, and ultimately the health office and helping to support that. And so today's conversation, again, is specifically tailored to just one small piece of what it is that we do at Joffe, and that's our health aid program. And so we'll talk through what a health aid looks like. We'll talk through some key differences between a health aid and a school nurse. And then we'll be sure to go through a number of different options and ways that the health aid can help support some other parts of your school, perhaps some that you haven't even thought of yet. Now, today I'm joined by Josh, who will actually lead us through the conversation. And in just a moment, I'll have him introduce himself as well as really take it away from there. But that's a quick face of both of ours, scary as though it may be. And before we get started today, we're actually going to share with you just a little bit of information. And I'll share with you, if you think back with us to the week before winter break, we had one of the strangest situations that we've ever seen, frankly. It was Tuesday morning, and all of a sudden at about 6:30, as I'm working on some emails and just really thinking about what was going to happen that day, I got a phone call that said, "We think LAUSD has closed their schools, and what are we going to do about it?" And I got that phone call, and then almost immediately I got about 15 others, and then I started getting text messages, and within about 5 minutes I went, "Oh, okay, there's actually a problem." And that led us to a school closure, obviously, for LAUSD and for many of our independent schools in the LA area. It led to some closures in the Northeast, and it led to a lot of concern in the rest of the country. And as a result of that, we have spent so much time working with schools that have increased their concern and or have had major responses that they need to get out to parents about whether they did well or whether they didn't, or whether they succeeded or whether they, well, perceived that they fail. And in most cases, that wasn't the case. But all of that is to say that normally we offer this full school safety assessment, and it's sort of our gift back to you for being a part of this webinar series. And as a result of all of the increased conversation and increased folks that we just need to be able to communicate with, today we won't be offering the full school safety assessment, but we will offer a health office assessment. And so it's a much smaller, much shorter version of that school safety assessment, but it'll allow us to come out, talk with you a little bit about what your health office looks like, and really dive into what changes, if any, you can make independently, what changes, if any, you can make with some support, whether from us or anyone else, and talk just a little bit about what the rest of that assessment could look like if we needed to come back and do that in the future. So that being said, we're excited to be able to offer at least one part of that normal assessment. The link is there on your screen and actually should be on the right-hand side. And so if you just click that Get It Free Today button, you can get signed up for it now. And again, as opposed to the normal full safety assessment, today's will be just a health office alone. So with that, what are we doing here today? Well, our goal is to make sure that by the end of the conversation that you understand the primary responsibilities of a health aide, and that you understand what your expectations should be from a reporting perspective, as well as an education perspective, that you understand a little bit about how the health aide can work with the disaster supply and preparedness program, and that you have an idea of what the health database actually looks like. And for everyone, each of these components is going to look very, very different. And one of the things, of course, you know, is that schools are so different on a school by school basis. And so we'll talk through some sort of quote unquote standards, and then we'll also talk a little bit about how those deviate and how some schools may look a little bit different than others. As we get to the end of the conversation today, again, we'll make sure that we cover any questions that you have, and also take some time to really dive into anything specific on your campus or anyone else's. With that, I'll go ahead and turn it over to Josh, and he'll kick us off for responsibilities and take it from there. Welcome, Josh.
Thanks so much, Chris. I hope everyone out there had a great new year and everyone's nice and relaxed for the second half of school. So with that being said, health aides, our talk for today. So what is a health aide? I'm sure most, if not all of you schools out there have some type of, whether it's an administrator, whether it's a school nurse that handles your students' sicknesses and illnesses. You know, it's vital, you must. But a health aide acts in a little bit of a different type of capacity. Yes, their primary responsibility is the wellness and the health and the safety of the students. But you know, as you'll see later on in this webinar, there are many more responsibilities that a health aide has. So what we'll do is we'll start with really the primary responsibility, and that's making sure that the students are taken care of from a health perspective. And that's going to start with non-emergency medical assessing and treating of both students and staff. So this can be anything that really a primary nurse would take care of. So it's going to be scrapes, it's going to be cuts, it could be a mild sprained ankle. It could be maybe they come in with a cold or a mild temperature, all the way to administering emergency treatment and medication within the scope of practice. So one thing that I've seen over my trips, you know, and I visited, you know, I'm sure I might have visited some of the schools that are on this webinar right now. One thing that I want to bring up is there have been numerous schools that I have visited where the health office, or, you know, what they consider the health office, is a cot in the business office. And while it's still a form of taking care of and still a form of treating and assessing injury and illness, it really does not lend itself to really ensuring that the proper health care is being given to that student or to that faculty member for that matter. So what we want to see when we come in, and really with any school, is we want to make sure that there's the proper almost flow of information and flow of care given to the children. That when they come in, whether it's, you know, let's take a head injury, for example. You know, children bump their head. We all know that. Unfortunately, what we don't know is how serious that might be. And what we don't want to get into is a situation where a children who bumped his head and you put a Band-Aid on it and you send them on their way while they might have a concussion. And what a health aide's job is really being able to sit there, use the proper diagnostic tools, and determine, does this child potentially have a concussion, or is it something that they just need a Band-Aid maybe some water, and they can be on their way. And of course, parent interaction, student and teacher interaction, this is all going to be part of this, but we want to make sure that we understand exactly what's going on so that we can take the appropriate action moving forward. So reporting, we all have to do some type of reporting when it comes to student health, and a health aide is gonna really take the time to ensure that all reporting and every single student that comes in, there's a detailed report that comes along with that. So when you have a student that comes in, and let's say they scraped their knee, or they twisted their ankle, or they broke a bone, well, of course, if they break a bone, they're going to most likely have to go have that treated, at the doctor's office or at a hospital. But writing detailed reports is always going to be the number one thing that health aides do as soon as they see a student. Of course, after that, the health information needs to be provided to the staff and families. The families, of course, need to be informed. They need to understand what's going on. And of course, I'm sure all schools out there already do some form of that. You're going to obviously bring the families involved if there's a child that needs some type of significant care. I think the difference in when you have an admin who has multiple responsibilities outside of healthcare and a health aide or a nurse type of role is the detail that you're going to get in that reporting and the amount of time we're able to take to really dive down into the specifics of what that visit to the health aide entailed, what symptoms the health aide noticed, and then what they think the proper steps should be moving forward. So school reporting is absolutely vital, and really the quality of the reporting is something that I don't think is taken into consideration a lot. I think a lot of schools just jot down a few notes, saw, student X or student Y came into office and, gave them a Band-Aid. Well, sometimes we need a little bit more information than that because if this is something that is chronic or recurring, well, we need that information to go back and then really have a better understanding of how to treat that and how to address that in the future. So with going off of reporting, another thing that, of course, we all need to maintain our faculty TB testing. And that's something that our health aides are going to help with as well. They're going to ensure that, when the time comes and the staff and faculty need to be updated with their TB tests, we're going to ensure that everyone is notified and that all of those tests are recorded and stored in the student health database. So health education. I think this is the first section that we're getting into that really goes beyond the scope of a normal health aide or admin. Maybe some nurses dive into things of this nature. Probably not all of them, but potentially some of them. Absolutely health aides. So health aides, above and beyond treating students, treating staff if needed, is health education and outreach. We find it imperative to not only ensure that our students and staff are well and healthy, but we want to make sure that they understand how to continue to remain healthy and well and in an active lifestyle. So part of that is going to include parent outreach. It's going to help parents, with different workshops, how to ensure that the students are eating correctly, how to ensure that the students are active, what steps to take if the child gets sick one night, should they come into school? Is it better maybe to leave them at home? We really want to make sure that our parents are really on the same page with the staff and faculty and that everyone really comes together in unison when it comes to our children's safety and health. And part of that is taking the time and going in front of our parents and explaining to them that sometimes it's better to keep your child at home. The last thing that we want is to have a child come on campus when they have a fever or they have the potential to either get themselves more sick or get other children sick. So that's something that we really want to stress. And then of course, students. One thing that our health aides do is, the talks that aren't that easy, such as, puberty and growing off, those awkward conversations. And although some people might try to stay away from these topics, it's something that we find very important, something that we want to ensure that our students understand. And so part of the Health Aide's jobs and really their responsibility is to help students navigate these topics. And they've all been trained on how to properly, go through and navigate these topics with students. That they're very, very well adept at really understanding the nuances and how to reach out to the students without making them feel uncomfortable. And same thing with parents. And I think it goes back and forth between parent outreach, ensuring that the parents understand, what's going to be taught to the students, and then back and forth back to the students, and what the Health Aide is going to portray to them, and with regards to health education. And we take preventative action just as seriously as we take actually the treating of the student. And health education is really our way of being able to do that, and really being able to be proactive in keeping our community safe. So disaster supplies and planning. Another aspect of Health Aide that goes a little bit beyond the scope of what you would normally see with a traditional nurse or an admin that might be currently handling your nurse needs. So most schools, if not all of you, are going to have AEDs on campus. If not, please contact us or go out and find one. They're absolutely imperative. They're by far the greatest advancement that we've seen in terms of being able to save lives over the last few decades. And especially today, some of the AEDs out there are just incredibly efficient in terms of their abilities to save lives within seconds. And one of the I know a lot of schools that are on this webinar right now have toddlers. And one thing I want to quickly mention, just going a little slightly off topic, is the idea of an AED machine that has a toddler key, is what we call them, or an infant key. And what that does is, we all know that AEDs have pads, and pads are, the things that are placed on the chest that help deliver the shock. And normally, especially in the older models, and still many of the newer models, the pads need to be changed out because obviously the shock that's provided to an adult is different than to a child. Well, these new models, for example, the Philips FRX, which is probably the AED that we work with the most with schools, has the ability to, you simply enter a key in and it's going to automatically adjust the shock. So if you don't have it, if you want to learn more information about the Philips FRX, feel free to reach out to us. We'd be more than happy to answer your questions on that. There's an abundance of information online. So that's something that you guys can look into after the webinar. So anyways, so disaster supplies and planning. Of course, student medication. We work with schools that wide spectrum in terms of illnesses, chronic, so diabetes, all the way to, anaphylactic shock, people with severe food allergies, to everything in between. And one thing that we need to ensure is that the medication is being kept up to date. I think we all know that, there was recently an Auvi-Q recall. And so one thing that a Health Aide would do is ensure and be on top of, not only the children, but more so the parents. We want to make sure that student medication is always kept up to date. And what we've seen is, if there's not someone who's actively monitoring this, we wind up seeing a ton of students who have medication that's either about to expire or that's already expired. And we want to prevent this. Medication that's expired, we all know, starts to lose its potency, fairly quickly. And that's not something that we want to mess around with. So a Health Aide's responsibility is really to ensure that the medication is always up to date. And, part of that is also ensuring that, the proper medication is taken. So if you ever go on a field trip, the Health Aide is going to help manage and is going to help, ensure that all the proper medications are being sold out on those field trips. We briefly went over AEDs, so routine checks, ensuring that the batteries are still working correctly, ensuring that the pads are still working correctly. We all know that the pads need to be changed out every 2 years. They're on a 2-year cycle. The batteries are on a 5-year cycle. So part of a health aide's responsibility is to ensure that those AEDs are being properly managed. First aid kits, same concept. We do not want to see a first aid kit that has a ton of expired supplies, or a first aid kit where half of the things are missing. If somebody cuts themselves, we want to make sure that there's some Neosporin and a Band-Aid. And if it's not there, then that can cause a potential issue, both for the kid as well as their mental well-being. We want to do as much as we can to keep our students comfortable, and that's all going to be the job and responsibility of a health aide. And then, of course, all of our health aides are coming from medical backgrounds. So either whether it's an EMT, a paramedic, a nurse, an RN. So one of the benefits of having a health aide on campus is they can act as an EMT at school events. So you might be hosting a carnival or a book fair, or whatever it may be, where you feel the need to have someone there just to ensure the safety should something happen. And a health aide would be absolutely happy and thrilled to be able to be part of that, and to ensure that everything runs smoothly, and the children, faculty, staff, and potentially parents are there to do what they're meant to be, and that's have fun. So the last thing we're going to discuss is the health database. Now, we use Magnus. Some of you out there that we've worked with previously might use Magnus as well. We use it because it's incredibly efficient, and we've had a lot of success implementing Magnus. It's a health database with schools that we currently work with. And the first thing that we're going to do is really go in and enter and manage all the health information on students. So this is going to be everything from life-threatening medical conditions, so diabetes, epilepsy, anaphylaxis, to managing faculty TB results, to ensuring that, and this is where everything's going to be documented. So we have a trail. So we have a trail of information that's going to allow us to go back and reference if needed in the future or in the past. So Magnus Health is going to help us really track and paint a picture for each individual student in an incredibly comprehensive fashion. Another thing that we do with our health database is we help report daily student attendance. This is going to, it's a little bit of a deviation from health database, but it's really not, because if you think about it, if a student's out and a student's out sick, we want to know this information. We want to know what prevented them from coming to school. We want to be in communication with the parents. We want to learn what it was, because part of the children coming back is really dependent upon, what the illness was, what the risk is for them to remain sick, or to get even sicker, or to potentially spread that to other students. So, we want to make sure that this is all monitored, and, part of a health aide's job in managing all of this is to learn and to gather this information so that it could be used to ensure that we're keeping the campus as, as safe and as healthy as possible. One last thing I want to bring up for the health database is, of course, immunization reporting. One thing that our health aides are going to do is report all immunization records to the state. And we all know that that's a requirement. It's coming into effect. And so that's something that will be done, and will be done on a regular basis. So with that said, I'm going to pass it back over to Chris, and he is going to go over a couple of different aspects of Joffe's health aide program.
All right, thanks so much, Josh. And I've got a couple of questions that have come in as we started here. And the first question was, what's the difference between a health aide and a school nurse? And I'll take that one. And I'll say that in some ways there's not a whole lot of difference at all. And in some ways they're two completely different concepts. And really it breaks down for me into a couple of different categories, or really three. The first is that a health aide is a person who's staffed and employed by Joffe. And so they're our responsibility to hire, retain, manage, train, and support. And generally speaking, a school nurse is somebody who is hired by the school. And so it's the school's responsibility to hire, manage, train, support, and so on. And one of the things that I always find interesting about that is, and this is a conversation I have regularly, well, who manages the school nurse? It can be difficult to manage somebody that you don't have a clear understanding of in terms of an education that leads up and prepares them for their function, in terms of what they actually do on a day-to-day basis. And so to make that make a little bit more sense, a lot of our heads of school are excellent teachers. And in fact, many of them started as teachers. Of course, others didn't. Others started as business folks and things like that, and have a little bit more keen understanding of that side of the school. But for so many of them, they've gone through the ranks as teachers, as school directors, as principals, and now they're heads of school. And so they have a very acute understanding of how to manage, how to support, and how to really lead their faculty. And in many of our schools, the CFO has the opposite. And in fact, what we often see is there's this great partnership between the head of school and the CFO, in that the head of school has that faculty understanding and the CFO has that staff understanding. Well, nobody really has the health understanding. And so a lot of times we see this challenge between the health office and, in some schools, everyone, and in others, just the administration, where they're just feeling alone. They're feeling like they don't have the support, the training, the development that they need to be successful. And at the same time, they have these very important deadlines that could shut down the school, and they have these very challenging conversations with parents about getting medications on campus and things of the like, and nobody takes them seriously, and so on and so forth. And if you can't tell, I've recently had several conversations with some health offices and gotten some of this feedback, and in fact, do that on a pretty regular basis. And so that's really the first key difference, is that our health aides are going to be folks that are managed and supported and trained by us, and we know health and we know schools, and so we can be that sort of bridge between the school and the person, or the school and the staff. In some cases, it's a number of folks in the health office, and it works out really nicely to be able to provide that support. And frankly, the support that's available is really twofold. So there's a team of people that oversee both our health aides as well as other parts of the company, our event safety division and things like that. And on that team, there's a police officer, there's a physician, there's a paramedic, there's a firefighter, and several other folks, and also some of our school safety consultants. And all of those people are there at any moment, 24/7, to help support the health aide as they run into questions, challenges, and problems. And so if it's a concern about a law enforcement activity that's down the street, we route it over to the police officer and let that person help navigate that situation. Or if it's a challenging new diagnosis that a child comes to school with, we hand that over to the physician and let them have that conversation and navigate those waters. And so that support that's available for them through that program is frankly unmatched. And that's one of the things that really sets them up for success. The second key difference is that the health aide is a single person on a team of many other health aides. And so when your school nurse calls out sick, more often than not, you've got two choices. You can either hire a firm of some sort to manage the staffing for the day, and that tends to be pretty hit or miss. Sometimes you can get some really great folks, and if you can get some good folks and even ask them to come back, oftentimes that works out okay. For a lot of schools, though, the challenge there is that they either can't find good folks or they don't know until the last second, and so they end up without a nurse for the day. And the health aides, generally speaking, have their own substitute system, and so we're able to backfill and to support one another, and even to plan some of those sick days and things like that with you and with them, to make sure that at no point do we ever have nobody on campus that can respond to an emergency. And finally, and this really comes back to that support, when a health aide's managing an emergency that they feel is over their head, and this is true for our school nurses and frankly for any of you that are listening as well, they have access to our emergency teams. And our emergency teams are a little bit different than yours. We don't necessarily have a search and rescue team or a first aid team or anything like that. Our emergency team is comprised of all of those different people I mentioned earlier, but that come together in a room in any emergency, large or small, and can help manage a situation. And so we deal with that team for things that are small, like hand, foot, and mouth disease. We deal with that team for things that are big, like lockdowns and fires and tornadoes and hurricanes. And we deal with that team for everything in between. And that includes child abuse and terminating employees and managing other sorts of incidents that happen on campus. And in each of those interactions, the team has that sort of multidisciplinary approach to, well, hey, this is my expertise. This is what I really know. Let's put that out on the table. Well, long story short, that's very accessible to the health aides. And again, it's accessible to each of you as well. If you're ever in a situation where you feel like you need the support, you can give us a call. And so long as we can activate that team for you, we certainly will do everything we can to do so. Of course, the difference is our health aides have that 24/7 and always available within minutes. So those are really the key differences between the health aide and the school nurse. And again, it's not to say that education, training, or capacity is necessarily different, but probably the one key is the ability to train, support, and manage those folks in lieu of or without having to have somebody on campus that really understands what it is that they do every day. There are a couple other questions, and I think these are getting pretty specific, so we'll probably reach out to you. What I would like to remind you is that as with each of these webinars that we've done so far this series, we do have that assessment, and I believe we'll put that back up on the screen for you in just a second. Again, just a reminder for this week, and hopefully we'll be back to the full assessments next week, but for this week at least, it will just be a health office assessment, so it'll be a little bit shorter conversation, a little bit smaller in terms of what we're looking at. And before I let you go, I'd like to share with you something that I'm really excited about, and hopefully each of you will be as well. And that is a mini-series that we're starting next week. So beginning next week on the 14th at 10 a.m. Pacific and 1 p.m. Eastern, we'll be covering each of the teams that you have on campus. So those emergency teams that hopefully you have in place: search and rescue and first aid, attendance and reunification, continuity and counseling, the command center, the rover team, the logistics team, the security team. I hope I got everybody in there. We'll go through each of those teams and really take some time to dive into each, all the way down to what groups of people make the best additions to those teams. So with search and rescue, it's sort of easy to think about that. Well, it's our people that are strong and capable and feel very comfortable going back into a building that's fallen down. Silly as it may be, those are the people that make sense. Well, for the reunification team, it oftentimes is people like the specialists that really do know every student, and sometimes even the front desk and folks that are answering the phones and things like that know many of the parents. The carpool team, if you are accustomed to having any sort of specific team or even a group of folks that do carpool every day, that team might be the best one to be on reunification. So at any rate, we'll take each team and we'll dive into who should be on it. We'll dive into specifically what their protocols and practice should be. We'll talk a little bit about how to develop and train them to make sure that they're as good as they can possibly be. And we'll also talk about communication styles and devices. So how do we communicate? To whom do we communicate? Who do we expect communication from? And how do we actually do that mechanically? Do we use a radio? Do we use any other sort of offline communication, or do we use Google Chat? And so we'll talk through all of those different components for each of those teams we mentioned. And again, that starts next Thursday, and it will carry all the way through to the third week of March, and we'll end with security and talking a little bit about what the security team should look like, both on a day-to-day basis as well as, in an emergency. So as we get ready and get started for that, we'll be asking each of you to participate, share some stories, share some experiences, and ultimately share some challenges with us that you've had with each of those teams in the past. And we are excited about it, cannot wait for it, and we hope that you feel the same way. So with that, I'll send you back to your busy catch-up in this first week back from break. We hope everybody has a great weekend. We wish everybody a happy new year, and we can't wait to see you next Thursday at 10 a.m. Pacific and 1 p.m. Eastern. Thank you so much, and have a great rest of your week.